Today, we're diving into something pretty profound, and for many, an almost invisible problem right at the heart of our healthcare system. We're talking about the gender health gap. It affects literally half the population in ways that are, frankly, as shocking as they are serious. And it all really starts with a single number: 4 years. I just want you to think about that number for a second. In the world of healthcare, what could 4 years possibly mean? Well, that's the average amount of time women have to wait for a diagnosis compared to men. For 770 different diseases, everything from diabetes to cancer, women wait an average of 4 years longer just to get a correct answer from their doctor. This isn't some rare one-off. It's a huge systemic pattern. Okay, so what's the impact of a delay like that? Well, that brings us to our next number. 25%. That's how much more of their lives women spend in debilitating health compared to men. So those 4 years of waiting, they aren't just an inconvenience. They add up to years of unnecessary pain, of uncertainty, and a really significant drop in quality of life. And these delays aren't just about living with chronic pain. The consequences get even more serious when the stakes are literally life and death. And we see this problem everywhere. Let's start with the heart. Heart disease is the #1 killer of women, and yet they're consistently underrepresented in clinical trials, and they are twice as likely to die after having a heart attack. Now let's look at the brain. 2/3 of all Alzheimer's patients are women, but a tiny 12% of the research from the National Institutes of Health actually focuses on women's health. This gap shows up even in the most critical moments. So imagine a woman goes to the ER with chest pain, the classic sign of a heart attack. Well, on average, she is going to wait 29% longer to be evaluated by a doctor than a man who shows up with the exact same symptom. And when it comes to cancer, it's like a 1-2 punch. First, women are diagnosed, on average, 2.5 years later than men. But on top of that, they have to fight so much harder just to be believed. They're twice as likely to have to report their symptoms 5 or more times before they finally get that cancer diagnosis. Beyond all the statistics, there's this deeply personal, human story. For so many women, their journey through the medical system is defined by one single infuriating phrase: "It's all in your head." This quote from the Autoimmune Association, it says it all. Almost half of the people looking for help with an autoimmune condition are labeled chronic complainers. And guess who the vast majority of those patients are? Women. This isn't just a doctor having a bad day. It's a deep-seated bias that gets in the way of a diagnosis. So what does that dismissal actually look like? Well, take premenstrual dysphoric disorder, or PMDD. For a woman to get a correct diagnosis, she'll see, on average, 6 different doctors over a period of 12 years. 12 years. That's over a decade of suffering without knowing why. And it's a very similar, painful story for endometriosis. This is a condition that affects 1 in 10 women. Diagnosis can take up to a decade. And in that time, 3/4 of them are misdiagnosed. They're told it's something else entirely, very often a mental health issue. And we have to note, the data shows this journey is often even harder for Black women, who are disproportionately affected but often left out of the research. And here's the direct result of all that dismissal. When women report that they're in pain, they are far more likely to be prescribed sedatives. Their physical pain is treated like anxiety. But when men report the same levels of pain, they're more likely to get actual painkillers. It's a huge difference in how their symptoms are taken seriously. So, why? Why is all of this happening? Well, the root cause is actually shockingly simple. For most of modern medical history, the default human body in research and in practice was male. The entire system was built on male data. This timeline just lays it all out there. The speculum, right? A tool used in millions of exams every year, has not been meaningfully updated since the 1800s. It wasn't until 1993, not that long ago, that women were even required to be in U.S. clinical trials. And a full, complete anatomical understanding of the clitoris, that wasn't published until 2005. And that history directly impacts where the money goes today. Think about this. PMS affects 90% of women. Erectile dysfunction affects 19% of men. But there is 5 times more research funding for ED than there is for PMS. It just shows you what the priorities have been. And if you zoom out and look at all global healthcare research, and let's take cancer out of the equation for a moment, it gets even more stark. A tiny, minuscule 1% of that R&D spending goes to conditions that only affect women. 1%. So this long history of neglect hasn't just gone away. It's created this huge ongoing problem. It's not just about what we missed in the past. It's about what we still, right now, just don't know about the female body. It really makes you ask the question, right? If the very foundation of our medical knowledge is this skewed, what on earth are we not teaching our future doctors? Well, how about this for an answer? A study just a few years ago found that over 3/4 of medical students feel they learned more about the biology of frogs than they did about the female body. Let that sink in. Frogs. And you can see these gaps all over the system. The NIH didn't even have a specific research branch for female organs outside of reproduction until 2012. So it's probably no surprise that over 70% of medical residency programs don't even teach about infertility. And that leads to huge diagnostic failures, like with PCOS, where up to 70% of cases just go completely undiagnosed. And on top of all this systemic ignorance, you have to layer on societal taboos. If 2/3 of young people are too embarrassed to even say the correct anatomical word to their own doctor, how can they possibly advocate for themselves? It just creates this vicious cycle of silence and suffering. So all of this data, all of these stories, they really boil down to one final critical question. We count on medicine to be scientific, to be based on evidence. So when we're talking about the health of half the human population, should gender really be a blind spot?